Behind the Mask, the podcast. Behind the Mask. Behind the Mask. With drwilliam, the OG genius. Behind the Mask, Mask. drwilliam. The more you know, the better you know. Behind the Mask, the podcast.
Friends, hello, everyone. Welcome to a brand new episode of Behind the Mask with me, your host, Gabby Allen, and of course, Dr. William.
Hey, Gabby, how are you?
I'm great. How are you?
Good. I'm super good.
Guys, as always, we will be learning everything you'll need to know before having plastic surgery, because the more you know, the better you look. Now, Dr. William, we've talked a little bit about, well, actually, we talked a bit about BBL.
Yes.
And brand new to me, what is this round two?
Round two, yeah.
I didn't know. I thought we were just going again.
Yeah.
I didn't know it was a whole separate thing. What is a BBL round two?
Well, you know, that's funny that I didn't know about it before either.
Do you know about it now, right?
Yeah, I know about it now.
Oh, my goodness.
Because I'm kind of awkward. Hey, what's the topic? Round two. What is
You're
that?
like, I've done it a few times and I'm still figuring it out.
Yeah. No, but the reason I say that is that it never was an entity. This was really created by patients. Isn't that kind of weird?
It is weird.
Yeah.
And also a little concerning. Tell me more.
Yeah, maybe. Well, if you go back in time to when, you know, if you look at liposuction's been around for, you know, quite a few decades now. But when it was first described and performed, and when I was taught how to do lipo, I mean, you really never lipoed a second time. That was almost written in stone.
Why?
Because of the scar tissue that forms after liposuction, it can make for a repeat liposuction very difficult. Blood supplies change after the first liposuction, so you can have, you know, not as good blood supply to the skin, so you have more complications.
Okay, I was going to say, so difficult being that it's a little more risky.
Yeah, difficult in terms of performing it just because of scar tissue, and also more complications because repeat lipo with the blood supply, more ischemia, which, you know, people call lipoburns, higher risk of fibrosis. And so it was just something that was never done. We never did it as plastic surgeons. And it's a really good example of how the patient population, the community, has kind of driven what's now done in plastic surgery. So we do things now and do BBLs a second time. So patients have a BBL. And then a second time, it's a round two. And sometimes even patients are planning who their second round surgeon is going to be before they've had their first round.
Okay. Why? Okay.
There's a lot to unpack here.
Yeah, there is a lot. I
I see your face. You're like,
Yes,
whoa, wait, back up.
Yeah.
You're like backpedaling
Yeah,
here.
exactly. Okay. Why? What and why is it round two?
So I do round two BBLs. I think they're legitimate to do. I don't do a second round BBL in every single person that asks me to do a second round BBL because some people don't have sufficient amounts of fat to do it. And some people have had too much fat already placed in their butt, which makes doing a second round more problematic to get a good shape. So I don't do it in every person, but I do it in kind of a select population.
Okay.
And the patients that I think are good candidates for a second round BBL are those patients that have something, you know, that needs to be changed. And in my eyes, I usually call it a squirt around.
Okay.
And what that means is, you know, I perform liposuction. Well, first of all, just with a BBL, includes liposuction. So sometimes people say lipo 360 and a BBL, but BBL includes all of it. It's like ordering a hot dog. You get everything.
Right.
And so with a BBL, you do liposuction 360 degrees around the body, circumferential trunk liposuction, meaning you liposuction the abdomen, the sides, the flanks, the back, the lower back. Then you take that fat, you transfer it into the butt. You get a bigger butt. You get a better shape. I personally put it into the hips a lot.
Okay.
And I graft into the leg. That is what I like to do. That gives me that convex part of the OG line. and the lipo gives me the concave part of the OG line. But really the thing that I love to do and that I do on every patient is I lipo in what I call the key area, which is kind of a little nebulous area between the love handles and kind of the top of the butt. And by lipoing in that area, I can really round the butt. And so to me, that I call it the key area because to me it's key, it's vital in order for me to get the shape that I want to get, which is the OG shape, which has that concave line and then the convex line.
Okay.
So not everybody does lipo in that key area, and it takes some time to kind of develop it and become good at it, because you can do too much lipo there, you can do not enough lipo there. It has to be kind of done properly, and so what I see as patients who are really good candidates and who I think I can get like a really good result, they're sort of like a home run for me, is if they come in and they've had a BBL, so they want a second round because they want to change something. But I think the best candidates are those patients that haven't had lipo in that key area. And so to me, they look square.
Okay.
So when I'm doing the evaluation sheet, I literally just draw a square and an arrow to a circle. And then I know what I want to do with that patient.
Okay. So sorry, I'm going to backtrack really quick.
Yeah.
So patient comes in before, because you said some people, before they've had one, they plan the second one. So what is the real objective or goal with a round two? Is it to improve on something they want? Is it just for changes, or is it because after time you need to enhance or just kind of keep up with?
Yeah, so I mean that's really good, your sort of assessment of that, coming from thinking round two BBL is just another time we're going to be talking about BBLs. But now you've actually seriously asked a really good question, because that's a question that I ask patients, like, what do you want to do?
Yeah.
And so I kind of group it into two sort of piles. Those people that are pretty happy with their BBL, but they just want more. So maybe they have some residual fat that wasn't removed. And so, I do spend a lot of time liposuctioning high in the back. And that can be an area that's overlooked. And so patients can get what I call a butterfly deformity, meaning they have like a really small waist where there's a lot of lipo done right around the waist, but then the upper part of the back still has a lot of fat in it. So it's that upper part of the back kind of is out like a butterfly wing, and then it comes in, and then they have their butt. So it's sort of like a butterfly.
Maybe we need to get you like pen and paper so you can draw this, and we can use our other camera.
I'll draw that for you after. But so, sometimes they need like a little residual fat removed, so that makes somebody a good candidate. Other times patients are, I really like my BBL, everything looks good, I just want more. So they may want more hips, they want more volume. Maybe they want their hips blended into their legs a little bit. I don't think that grafting fat into the legs is always performed with a BBL. Okay. If you kind of go back in time, the way I kind of look at it, because if I really go back in time, I mean, I haven't seen the birth of breast reconstruction. Okay, that was started a long time before I started plastic surgery, but it's relevant here because with breast reconstruction, if you go back years ago, the goal was just to restore a patient's breast. So patients had a mastectomy, and then we were trying to get them, a breast mound, we used to call it. But now things have really changed, and now we're trying to make women, and I don't do breast reconstruction. I've done a lot of it in the past, but now the standards are totally different, and so patients are trying to get a pretty breast, a beautiful breast, a nice looking breast, compared to just getting reconstruction. So we've seen that trend in plastic surgery with breast reconstruction, and now we're a little bit earlier in our BBL history, because BBLs haven't been performed as long as breast reconstruction has. But we're starting to now see some of those changes. And again, it's patient driven. We listen to the patients, and they over time kind of tell us what they like. Right. And so what used to happen is just liposuction around the waist, and take the fat and place it in the butt. You have a bigger butt, and we're done. But as time has gone on, and this is what has made it very fascinating, is once we kind of learn that technique, now it's like, oh, well, it's going to look better if we put some hips here. It's going to look better if we blend that fat into the leg. And so it's going to look better if we do more liposuction higher in the back, because it's not just like at the beginning, it was like small waist, big butt. And it's much more sophisticated now.
So it has to blend.
Yeah, it has to blend and it has to get that line. And so I think when somebody has a BBL and they're not totally satisfied, I think sometimes that model is still being applied. So it's a lot of waist lipo and then injected into the butt. So sometimes people will be like, well, I'm happy with my projection or my volume of my butt, but I think my overall shape can be better. And those patients, to me, are very good round twos, because then I can go re-lipo up in the back, remove that fat that really wasn't removed before, clean up some of the other areas, and then liposuction through that key area, which will round the butt, then build out the hip, blend that into the leg, and if they want more volume, then I give them some more volume. So that, to me, is like a really good round two patient. I'm not a big fan of this is who I'm going to do my round one, then I'm going to do round
I was going to say,
yeah,
what
I saw
kind
you
of
were
situation would a patient come in and say, okay, for this first one, I would like one butt cheek, and then round two, I'll take the other one?
No, it doesn't work that way.
How, how can you know what you would need or want?
And
or maybe
can't.
other than, I think to me, what makes sense is, okay, I'm going to do this size, I want to go bigger, do it like just enhance the shape. That would be a round two. So I guess, what is the situation where a patient comes in and says, here's what I want for round one, and I'm definitely going to have, and I want to pursue it round two for these reasons.
You can't really do that.
Right.
And so
I feel like that makes sense.
Yeah. And it's not, like, I don't do a lot of round twos on my own patients because, I remove the fat and I put it where I want it. So it's not very common, because patients don't usually have fat that's left behind that I can use, and you need to have fat in order to do a round two. Right,
because we love fat.
I mean, that's
We love fat here.
It's fantastic to it's to use and a tool and to shape. So I'm not a big fan of this is going to be my round one and this will be my round two kind of thinking, but it has kind of moved in that direction. What I don't do, I never do a round three, because it's just, there's too much scarring that's underneath from the liposuction, and it's just, in my opinion, it's too risky to have complications with the skin, and so I don't do a round three. Never do I do a round three.
What percentage of all of your round two patients, how many of that group did you do round one with those patients, or is it more?
Oh, the minority.
Okay, so it's people who have had their round one or first with a different surgeon than you're. Okay.
And I think that it's interesting or important to point out that, like, to get a round two, it doesn't mean that your round one was poorly done.
Mm-hmm.
I mean, sometimes patients will come in and they want a round two, but I'll say to them, like, you look really good. Like, you don't need a round two, or you don't have enough fat, or your shape is all really, really beautiful. And there's a lot of really good BBL surgeons in Miami. I mean, we've been doing BBLs in Miami for a long time. That's where I actually came to learn to do a BBL, with Dr. Mendieta, who practices here in Miami. I mean, he literally wrote the textbook. And so I, years ago, visited him to learn how to do it. And at that time, there was only round one. No one ever talked round two. Mm-hmm. So that's something that's developed over the time. But that's what I believe is, if you look good and you have a good shape and your fat's been removed, then I think that's it. You don't need a round two. And the patients that benefit from the round two are those that are not particularly happy with their shape. And it doesn't necessarily mean everything is just terrible, like they were botched or there was some problem, but there can be like refinements. And that's why I say, like, I think those really good candidates are those that have come through. They haven't had lipo in the key area. They're square. They don't have as much hip as they wanted. And this gets back to the whole concept of finding the surgeon who you like their look. Mm-hmm. So Not every surgeon wants to have as much hips, or not
Yeah.
every surgeon will put it in the legs or things like that. And not every patient wants that. So that's why I always tell patients, this is the look that I like to do. And if you like that look, then I can help you. If you want something else, so I do think there's some changes that happen if someone has around one BBL, and maybe they didn't realize that they liked a little bit more hip, or
Okay.
maybe they didn't realize that doctor didn't do that, or and that brings up a whole nother topic about wish pictures. Do you know wish pictures?
I think we've mentioned it briefly.
Okay.
But just I'm assuming what they wish to look like. Like this is
Yeah.
here's me and here's what I want to be.
Yeah, I guess it's not that complicated.
Did I nail it? Did I get it?
Yeah, Brittany
Okay,
nailed
good.
it.
Context clues. She went to college.
So, yeah, and that's why wish pictures are not particularly helpful, because you can have one idea in mind, but your body's just not capable of doing that. Either your tissue won't move or your underlying structure. I mean, there's some limitations there. But I think sometimes if patients are going to see somebody with a wish pic, but you can't accomplish that look, then they're going to be unsatisfied from their round one, and then they're looking for a round two.
You mean you can't build me like Kim K? You can't take this square?
Nah, you're not a square, that's for sure. But that's just everybody's body's different,
Sure.
so we're starting from different positions for everyone.
Do you ever get the situation where the patient's need or want for a round two is from significant difference in their body, maybe due to weight gain, and then wanting to use liposuction to kind of maybe get that shape back?
Yeah.
But then is it just liposuction, or is it round two at that point?
Well, I mean, that's a good question, and I think for people that had BBLs a long time ago, and then maybe they've had children, or they've aged, or with time and things have moved a little bit, or they put on some fatty deposits, then yeah, it's good for that. And patients will come in and they'll tell me that, I'm like, were you happy from your round one? And they'll be like, yeah, I was happy with my round one, but it was 10 years ago, and I just think that it can be, sort of updated, if you will. And so that's a good patient. We can remove fat there, and we can get a better shape. And like fashion and facelifts and a whole bunch of things change with time in terms of what we like. And I do think that people like hips more now than they used to. And I know personally, because if I go back and I look at my practice, I could show you, many photos of patients that had hips, or saddlebags, we would call them. And then now, then their post-operative photo, they're straight because they didn't want to have the fat there. So I removed it. And that was kind of that's a different look than what is wanted now. I mean, I never lipo in that area now at all. I add fat to that area.
Because that's the shape. That's
Yeah.
the look.
Yeah,
you're going
and
for,
I've been doing that for a long time, because that's the look that I liked. I liked that shape, and so I think now that shape is a little bit more popular, probably. And so, if you had your BBL like a long time ago, and you really didn't have fat put in that area, and you didn't have as much hip as you want, that you want now. It's not that you had a bad BBL or you didn't get what you wanted back then. It could be things have changed, and you've put on a little bit of fat from just with the time, and so you want to get a little bit different shape. So that's also like a really good candidate for a second round BBL, as long as the patients have fat that we can use.
Yeah.
And their tissue is soft enough that we can change the shape by adding the fat, then those patients are good candidates for round two.
Okay.
But it is interesting. It's an interesting story how that's kind of driven by patients.
Yeah, no, absolutely. I mean, it's, people, you get what you want, I guess. No, you absolutely can. Power of the people there.
Well, it's we're all learning and kind of moving through this process together, because BBL is rather young.
How young? When did this refresh my memory?
Well, we're looking at, really since it's been popular since the, 2000s.
Oh, okay. Yeah. So not.
Yeah,
that long ago at
nothing
all.
like breast augmentation's been around since 60s.
Well, I guess that makes sense too because I think the look back in the day was small butts, but
yeah.
now I like big butts and I cannot lie.
Yeah, that's true.
I think now's a good time to get into one of our bits,
Oh,
right?
what is the bit?
Today we're going to head over to social media. We've got a question from Instagram.
Oh, okay, good.
Oh, hang on. The Grams get a question.
Oh, the Gram does have a question. And today's question is, if I gain weight, will I have more projection in a round 2?
Okay, that's a really common question. It's a good question. It's not a simple answer.
Oh, never is.
It never is. It's not short either.
Right.
Okay, but this gets back to the point. So the general concept here is, I've had liposuction or I've had a round 1 BBL.
Okay.
And I want to have a round 2, but they're worried that they don't have enough fat.
Okay.
Should I then gain weight? Well, the answer is yes, and the answer is no.
Okay.
All right?
Simple.
Okay,
There
great.
you have it. Anyways, thanks, guys.
So the reason is it's because it's helpful to gain weight if the weight is going to be gained in an area that we can then use and liposuction and get that fat.
You can't tell the fat to go only in one place.
You can't tell it to go any place where you want it to go. Sometimes the fat you'll put on fat internally. So visceral fat, internal fat, as opposed to the external fat that I can remove with lipo. So internal fat I cannot remove. So if you've had like really thorough liposuction, there's not a lot of fat cells left on the outside of your body, and you gain weight, you're only going to put it on internally. And so sometimes I will see patients that come in and they'll say, and I'll be like, I can't do a round 2 because you don't have enough fat. And they look at me like I have, 3 eyes, because they're like, well, I've just gained like 20 pounds. So how is it possible that I don't have enough fat to use for a BBL? And it's because all of the external fat cells have been removed with lipo before, and they gain the fat, and it's only internal. We can't use the internal fat. So if patients have residual areas of fat outside of their body and they gain weight, then that becomes usable fat that then I can use.
Because it's accessible.
It's accessible.
You can actually move it around.
I can remove it with liposuction, and then I can transfer that fat. So that's why it's a little bit more of a complicated response or question. And sometimes it's difficult for patients to know if their fat is internal fat or external fat.
Okay, so then my 2-part follow-up is, how do you find out which category of fat you have?
Yes.
And my second one, I just forgot, but it'll come back to me. So
Oh,
let's
that's
start
good.
there.
I'm glad you forgot, because I don't like 2-part questions because I can never remember what the second part is.
Clearly,
So-
neither can I.
Okay, so that's good. Your 2-part question is a 1-part
It
question,
is.
which is good for both of us.
And then a mystery element.
So we'll bring that out. So yeah, I mean, that is the most difficult thing to explain to people, and I've made a lot of videos. Oscar has done a lot of graphics trying to explain to patients, what is internal fat and what is external fat. And it's difficult to describe to patients, but what I tell patients to do is, like, if you kind of look at your shape and you look like your abdomen is more protuberant, not necessarily pregnant, but just, has that little bit more of that shape. And if you push on the outside of your skin and you immediately get into your abdominal wall, you feel like your hard abs, if you will, then, that most of that shape is coming from inside, and that's the internal fat that we can't use. But a lot of times I can tell in photos if they have internal fat versus external fat. So patients will send me photos, and then, we can look and see. And then other times just examining patients, you can tell. But I know it's difficult for patients, and I do feel sorry for patients who are kind of naturally thin people and they had a BBL and they want a different shape to their butt, or they want more volume, so they gain weight to do that, and then they come in and they see me. I'm like, you just need to lose weight. And they're like, what? I've gained weight for this operation, but they really have the internal. And so you really can kind of just feel the abdominal wall, and you're like, okay, there's just not much here on the outside that you can push. because you immediately hit that abdominal wall.
Okay.
So that's my best explanation for how you tell whether you have internal fat versus external fat.
Okay, so then let me give you this scenario. I just I had liposuction, and now I would like a round 2, or I'm just having maybe any other procedure. Is there a correct way to gain weight, or like we said, there's no way to say, okay, fat, you guys can only
Yeah.
go to these areas, if only, right? But, is there a way to correctly put on that weight, or is it just kind of like a certain diet or nutrition plan?
No, I mean, I always say that I'm not probably the best person you should be asking nutritional advice from. I haven't mastered that topic myself. But no, I mean, there's no particular way to do it so that it goes one way or another. It's just all directed by your genes.
Ooh.
I mean, you see people. I mean, if you just look at patients, sometimes you'll see people with large collections like under their arms or like the bra fat area. You're like, why do they have so much bra fat? And yet, their waist could be relatively small. So it's just genes. And if you end up gaining weight sort of in that area, if you didn't have a lot of liposuction in the upper back and you do gain weight in order to have a round 2, then that fat can be used, and that's really helpful because it's almost like just new virgin fat that has not been liposuction before. And if those fat cells in that upper back are so inclined to put on fat, then that's really good. That's really helpful. So it kind of is just luck of the draw in terms of your genes. I will say that I rarely really ask people to gain weight. Most of the time I'm telling people I think you should lose weight. And it's for that very reason, because when we put on fat, if it's put on internally, it's just not helpful. And the other point I want to make is that I think patients tend to overestimate the amount of fat that they need.
Okay.
So they end up putting more weight on than really that's necessary. And that's why we can do like skinny BBLs, because patients can be thin and of a low weight, but they have a collection of fat, like in the love handle area, for
Okay.
example. And I can take that fat and then put it in the hip and augment the butt with that. And we don't need as much fat as people think we do. So I'm not a big proponent of telling people to gain weight for a second round BBL.
Right.
My main thing is, if you've got a result that you're either not happy with, so that's where the squared around comes up, then I think you're a really good candidate. If you have residual areas of fat that need to be removed, then you're a good candidate for that. If you like your BBL and you just want a little bit more, then that's a really good candidate for that. But I think where people run into trouble is if they really just don't have any more fat left and their shape may not be exactly what they want, or they just want more, but we just really can't get enough fat, then those patients that gain weight are really just not going to be able to help themselves because it's just going to go internal.
Okay, so we have learned about internal versus external fat.
Yeah, and I'm sure we'll be talking about it again. This is such an
Yeah.
important topic.
Well, yeah, I think even too, I think I would love to know, and I'm sure our listeners would love to know kind of how maybe to be able to identify, okay, this is with, looking at their own bodies, or however you're able to assess, okay, I have this internal fat, or I have this external fat, or, let me save the time or the appointment, make sure I'm at this weight before, so we can just already get into the next step of it.
Yeah, and from my experience, I mean, some people know when they have internal fat, but other people just don't know that they have internal fat, and so it's it's tricky. There's no simple way just to kind of figure that out.
There's never just the simple way, is there?
Patients.
Well, let me ask you my last question then.
Yeah, sure.
Is the recovery process from a round 2 different or very similar to regular BBL or round 1?
I mean, it's similar in the fact that you're going to be leaky afterwards. It's very messy. And you're going to have kind of, similar recovery with that respect. But I do think my experience is that it is more uncomfortable for patients,
Really?
which is just a doctor euphemism for it's going to hurt more. And I mean, sometimes I tell patients, listen, it's going to hurt like hell. I don't like to sugarcoat that. The first 3 or 4 days after BBL, no doubt, is very difficult. I do have patients that come in and it's almost like you have a like deja vu. You're like, wait a minute, didn't I just operate on you yesterday? Like, why are you wearing normal clothes and you look like you didn't have surgery? But that's not very common. I mean, it's an uncomfortable thing to go through. It's difficult to go through. And I do think that it hurts more in the second round because the fat is harder to extract because of the scar tissue. And so it takes a little bit more force, and with a little bit more force, and it can create a little bit more pain. That's my experience.
You know what? I am very interested to watch this back because I know I had no control over my facial expressions that time because that sounds terrifying. And for the girlies who've had round 2 and you've experienced that, you're a warrior, you're a brave, you're a goddess. Get it. Pain threshold high, that's impressive because it sounds very
tough.
It's a lot on your body. It sounds taxing to say the least.
Yeah. No,
and
I think that's totally a fair assessment. Yeah.
Well,
that's really why I don't operate on men, because men tend to have more internal fat than women do. And
tears.
And the pain.
Yeah.
The pain threshold.
Women are strong. Women are amazing.
And that's not a joke. Like it's, and maybe I'm going to get in trouble for being sexist here, but I always say, patients can be in a lot of pain. You can tell their facial expression, and but the women will say to me like, well, it's not as bad as when I delivered. They remember that 10 out of 10. And I always say that men's 10 out of 10 is whatever you're doing to them at that moment. They're like, this is a 10. I'm like, okay, we're just removing a mole here. Yeah, this is the local anesthetic stinging a little bit.
Try being a woman.
Yeah, so, it is a lot to go through. But I do see value in a round 2. I mean, I've seen really good changes with round 2s, and I do like to perform them. And I do think it's beneficial. Going to the round 3, I think is just, that should not be, I'm never going to get to that stage.
All right. So not a round 3. We've learned all about round 2 today. And you know what? Let me check. You know what time it is?
Oh, don't say it.
It's wheel time.
Don't mess with me. It's a wheel time?
It's time for our OG.
We love the wheel.
We love the wheel.
Love the wheel.
Look at her. She's on her way. She likes to make an entrance.
Yes, the wheel takes her time.
But if you don't know, then now you know.
You have to turbocharge the wheel. We'll send the wheel out to Houston to Hennessy.
If you know, you know.
Get a little more horsepower in it.
Yeah.
If you know, you know.
Well, she's here. She's arrived. It's time.
All right, Gabby, give it a spin.
Let's spin it. This is my game show moment.
You like
One
it.
day I would love to be on a game show. I would love to host a game show. So this will do for now.
Well, you do sometimes at the rink.
That's true. That does count.
Yeah.
Ooh, fact or myth.
Fact or myth.
I really want to hit the OG chef though, but we're gonna get there one of these times. Okay.
Fact or myth.
Oh, that wasn't straight at all when I was pulling that down. Here we go. Fact or myth. Okay. Fact or myth?
Mm-hmm.
Once you have liposuction, oh wow, so relevant. Once you have liposuction, the fat doesn't return, doesn't come back. Evicted. Is that true?
That is true.
Because
Did you think it was a myth?
I don't know. I didn't think much about it.
Well, so that's...
Well, because you were saying the fat cells are
they're gone.
So...
And the analogy I always tell patients is, imagine that I'm a demolition expert, which actually I did demolition when I was in college for
when
a
you
summer.
were going to be an engineer?
Yeah, that was actually during one of those in-between times.
Oh, okay.
And I did demolition. And but anyway, so if you imagine I come into your kitchen and you want new kitchen cabinets. And then you see me take my big sledgehammer and I knock down half of your cabinets, for example, and I put them in the dumpster in your driveway. And then you ask me, oh, can I still store items in those cabinets? And I would look at you like,
What cabinets? In the
you
garbage?
saw me take them out of your house, right? So it's the same thing. Those cabinets are gone.
Mm-hmm.
So those cabinets are like the fat cells.
Okay.
They've been removed with liposuction. They're no longer there. They cannot store any more items. They can't store any more fat. They can't store any more cans of beans
They're not
because
there.
they're gone.
Yeah.
And so the fat will not return there. If you maintain your weight, which is really what you should do after liposuction, then nothing will change. And all those fat cells are gone, and you're going to maintain your new shape. If you gain weight, then it would be like storing products in the cabinets that are left behind.
Which is that internal fat?
It can be.
Okay.
So it can be internal fat. It can be external fat. So you could put it on your cheeks if your body decides, okay, this is where I'm going to store this extra calories I'm going to do there. It may be in your arms. It could be some other location where you have not had liposuction.
Okay.
And so that's why you should not gain weight after liposuction. And that way the residual cabinets that are remaining in your kitchen, the doors are going to be closed and everything's fine. If you start really gaining weight, it's like putting more and more and more cans into those remaining cabinets, and then the doors don't close, and then there's overflowing onto the counter and things like that. So fat removal from liposuction is permanent. That is a complete truth.
You can still put weight on.
Fat in other cells that are remaining behind that were not removed with liposuction, but it's permanent. I mean, those fat cells are no longer there.
Okay. So we learned a lot today.
Good.
I learned all about round 2.
Yes.
And it's not just one butt cheek at a time.
No, that's
No,
not.
it's not. Not my
No,
original
that would
thought.
not work out well.
No, I don't think it would.
Yeah.
What an interesting recovery experience. That
Yeah,
would
and I'm
be
starting to question whether you would ever really do well in plastic surgery if you with that approach.
Maybe I'd be better as an engineer, probably.
Yeah, I can see
That's
that.
okay. Well, guys, thank you so much for hanging out with us. We learned all about round 2 of BBL and liposuction and good fat and internal fat and external fat and fat. We love it all.
Mm-hmm.
We do. Thank you again, Dr. William.
Thanks, Gabby. I really
It's
enjoyed
been a
it.
great time. Wheel, killing it as always. Guys, don't forget to like, subscribe, follow. Join us on our next episode as we hang out, learn more, and maybe start doing some TikToks. OG Chef
I look
comes
forward to
out.
the yeah.
We're gonna
The
do
chef,
some fun
yeah.
stuff.
It's kind of rude, that chef. You know that?
The chef is rude?
Yeah. Yeah.
Find out why. Come in return. We'll learn more.
Bye-bye.